start with Erin's bio. Erin Cushing serves as the chair-elect for the AAMFT Family Therapy in Schools TIN. She's a licensed marriage and family therapist and approved supervisor in the state of Connecticut, maintains a small private practice, and has been a clinical faculty member in the Marriage and Family Therapy graduate program at Southern Connecticut State University since 2014. We have Wade Fuqua, who is a licensed professional counselor and licensed marriage and family therapist. He received his Bachelor's of Arts degree from the University of Central Arkansas in psychology in May 2010. He completed his Master's of Arts degree in marriage and family therapy from the University of Louisiana at Monroe in 2012 of May, and his Doctor of Philosophy in marriage and family therapy in May 2020. Congratulations, that was recently. Wade's work history consists of 7 years practicing school-based therapy in Little Rock, Arkansas as an employee of an outpatient mental health agency. During that time, he worked on multiple school campuses and spent 5 years on that time embedded in one elementary school campus. After leaving direct care services to supervise other clinicians within the same agency, Wade worked to support those clinicians in his office practice school-based therapy. For the last 2 years, Wade has been in private practice, at Channel Family Therapy, PLC in North Little Rock, Arkansas. There, he sees families and couples as well as children who are struggling with school-related problems. Wade utilizes his experience from working in schools to help families work with their school-related problems when therapy services are not available at the client's school. In addition to seeing clients, Wade directs the Medicaid service line at the Channel Family Therapy and supports ongoing development of the company's school-based private practice model. Wade is also married with 2 daughters and currently lives in North Little Rock, Arkansas. We have Eileen Klima, who is originally from Los Angeles, California. In 1990, she received her Bachelor's of Arts degree in psychology from Cal State University, Northridge. She's earned her Master's degree of Arts in psychology with an emphasis in school psychology in 1993, and then in 2006 completed a second Master's of Arts degree in psychology with an emphasis in marriage and family therapy. Both degrees are from Humboldt State University in Arcata, California. Eileen has worked in Humboldt, California for the last 28 years as a school psychologist and a licensed marriage and family therapist for schools from kindergarten through 12th grade. She's currently employed as a student assistance counselor at the North Humboldt Union High School District. And Eileen works full-time counseling students and their families at Arcata High School. She lives in Eureka, California with her husband, Ken, and they are parents of 4 adult children. And we have Dr. Kathy Londy, who is a licensed psychologist and a family therapist who has treated children and families for over 40 years. She is the chair of the Family Therapy in Schools Topical Interest Network of the American Association of Marriage and Family Therapy. The TIN group, this group works to nurture and group of collaborative school-based family counseling and therapy services in schools in order to boost student achievement and resiliency. A fellow of the International Oxford Symposium in School-Based Family Counseling, Dr. Londy received their Outstanding Contribution Award in 2017 with Dr. Ralph Cohen. Dr. Londy is a faculty member of Counselor Education and Family Therapy Department of Central Connecticut State University. She and Dr. Cohen helped enact legislation of family therapists to become school certified in Connecticut in 2007, the first state in the U.S. to do so. She trains graduate and postgraduate MFTs for school-based practice at Connecticut State University, and she is also the author of a book called Building School-Based Collaborative Mental Health Teams, a Systems Approach to Student Achievement, and is a frequent presenter on school-based practice. Dr. Londy is an American Association of Marriage and Family Therapists Clinical Fellow and approved supervisor. With the AAMFT colleagues, she facilitates the Interactive Supervisory Refresher Course. She is a past president of the Connecticut Association of Marriage and Family Therapy and has held several positions within the CTAMFT and AAMFT. Dr. Laundrie is a member of Division 43 of the American Psychological Association. Yes, Logical Association, and her undergraduate training was in special education at University of Cincinnati, followed by a master's degree in social work from Ohio State University. She's completed her doctorate in psychology at Antioch, New England Graduate School, and her internship and postdoctoral training were at Yale School of Medicine and the Yale Child Study Center, where she taught before joining the faculty at CCSU. And finally, we have Laura Wallace, who is a PhD and an LMFT, a core faculty member of the Antioch University Seattle's Couple and Family Therapy Program, and the owner and clinical director of Twin Lakes Counseling, a psychotherapy group and practice in Federal Way, Washington. Before becoming a therapist, she was an elementary school teacher and brought that passion for education into her therapeutic work. Laura has spent several years conducting and supervising school-based counseling and did her dissertation research on classroom-based solution-focused intervention called Working on What Works. Wow. So with that said, welcome TIN group.
Thank you, Sheena. Thank you so much. And I am just so thrilled to introduce our team that has been working together. What we are going to be talking about is what AAMFT has done over the last couple of years to really begin to build systemic relationships across the country in various new settings. We're going to do a PowerPoint, and I'll do the first couple of slides, and then each member of our team is going to follow it. So I'm so happy to introduce our team to you. Eileen, of course, has presented at Oxford before, so you know her work. But with Laura and Aaron and Wade, you're going to actually be hearing from Wade next. He's going to be presenting day after tomorrow, I believe. So you'll get to hear firsthand what their research is about and what they're doing. So welcome again, and you will see everybody's face pop up as each one of us talks. Okay, again, I'm at Central Connecticut State University. Erin is one of my mentees. She is now on the clinical faculty at Southern. Wayne is at went to University of Louisiana at Monroe. Laura is out and she's now core faculty at Antioch, Seattle. And dear Eileen is from Humboldt, California. So that is who our team consists of. And just to fill you in, particularly for those folks who are from other countries, marriage and family therapy, as you will hear today, was started by a bunch of renegade psychologists, social workers, psychiatrists, and counselors who became somewhat frustrated in the 1950s with the more psychoanalytic linear ways of working. And so they decided, with all of the other wonderful work that was being done by other systems thinkers, to create new ways of working with families. And AAMFT and marriage and family therapy as a profession began around, we became licensed around the 1990s in America, that as of late 1990s, all MFTs across the country are now licensed who pursue it. So since then, what's happened is that because we have licensure across the country now, there are many new areas like family medicine, like the military, like schools, where marriage and family therapists have been looking at systemic ways to foster relationships with these new practice areas. So what they did was they created this Topical Interest Network among its membership. And what's really important about this is that I think, well, Sheena told you that I'm also a psychologist and a member of Division 43, which is couples and families. We have 57 different divisions in psychology, but we are very much caught in the linear kind of siloed approach where there is not a lot of collaboration across the different divisions. And so what AAMFT wanted to do was to develop systemic ways of developing sets of these special interest groups. And what this presentation highlights is the first 2 years of accomplishments of our Family Therapy in Schools Topical Interest Network. So there are 3 ways we have found that we have grown in school-based work through conversations that we have had with our membership. We've got well over 300 members now in our school-based family therapy group. And what we've been doing is getting to know people through bi-monthly Zoom interviews with school-based family counseling and therapy across the United States who develop innovative based practices. And several of our speakers have included the likes of Dr. Brian Gerard, was one of our speakers this year, and also Michael Carter and Emily Hernandez, who are members of our symposium. And we have looked at what they've been doing at Cal State in Los Angeles with families in schools who often come from different countries. So they've done some wonderful international work. So we do these every other month Zoom interviews for our membership. The second thing we do is we publish a bi-monthly spotlight newsletter to showcase one or another school-based clinician who practices school-based family therapy, family counseling. And then the third thing that we've created is a website and a member forum and a Facebook page for our TIN members so that we can touch base with each other across the country, across the world as we need to. And it's really, we have been very, very surprised, delightfully so, with the COVID crisis that's happened and the cultural changes that are going on in the United States right now. The last presentation we had just, it multiplied by 10 the numbers of people who attended. So it was really very well received and timely. So those are the 3 ways that we are working. And then our team is now going to talk about the different ways that MFTs have been joining multidisciplinary school teams. The first is through school certification, and Erin Cushing is going to talk about that starting with the next slide. And if I can brag about Erin for a minute, she was one of the very first school certified MFTs in Connecticut. There she'll talk about school certification in Connecticut and elsewhere. The second way is through contracted arrangements, and Wade and Laura are going to talk about that. Contracted relationships between schools and primarily private practices, but they will be highlighting some innovative ways that MFTs are joining. And then Eileen is going to talk about the community partnerships that she introduced when she talked about Humboldt County last year at Oxford. So here is my team, and here is what they have found. Erin?
Thank you, Kathy. So what's been really great about our national and international forum set up for our TIN is that we really were already well prepared to utilize Zoom and other formats to kind of connect with each other. And so we've done a lot of networking and collaborating with our members around how they have been working in schools and how they've been able to do that in a variety of capacities. So as Kathy previously mentioned, school certification has been one of the kind of primary modes of doing so, and Connecticut was the very first state in the country to create a legislative format for such in 2007. So as some of you probably are well familiar, Dr. Landy and Dr. Cohen worked tirelessly for 10 years to create school-based MFT certification in the state of Connecticut that passed in 2007 with very clearly written guidelines for MFTs. And then in the subsequent 2 years thereafter, regulations and state requirements were completed to put that together. I apologize, my neighbor's dog is with me. And so let me put myself on mute for just a second while someone's here. Kathy, do you mind taking the second part of this just while I need to mute myself? Thank you.
Sure. Um, this is one of the values of Zoom, you all. So since 2008, what's happened is that we have found that with certification, state by state licensure requirements, regulations, and certification have really varied, that it's not the same in all 50 states. And so to get a group of committed people who are willing to work on this, understand it, we are working with AAMFT to try and identify specifically how this is occurring. But we are realizing that it does vary, and that the school-based clinician designation can cover many mental health disciplines. But again, you know, as systems thinkers and as the renegade profession that has, particularly people of my age, members of who were formerly trained in other mental health professions, it's a very collaborative kind of approach. So, Erin, are you ready?
I will try. I apologize. My world's been upside down this week. I have no power or internet, and so things are out of sorts. Regardless, at my home that is. Regardless, as Kathy probably mentioned, there's been other states to have followed suit and have created opportunities for MFTs to also work in schools. So because state by state regulations vary so considerably, not all have been able to formalize a certification process as Connecticut did. And so a lot of states have created what's been called school-based clinicians or other similar titles to allow for any one of the 5 or 6 mental health capacities, mental health professions to work under that umbrella term, so to speak, and then be able to work in a more kind of sort of certified approach to work in schools under that, that designation.
Okay, and Erin, do you want to introduce Laura and Wade?
I'm sorry, I'm trying to find the slide. Yes, so Wade and Laura are going to talk momentarily about other manners of working in schools.
All righty. Hi, everyone. I'm so excited to be here. So my name's Wade. I'm going to talk first a little bit about kind of the other approaches to be able to work in schools. I, for example, live in a state in Arkansas where there is no state certification for MFTs. And so I have a different way of working with schools. And one option is as a traditional private practice clinician, as Kathy mentioned, using family therapy and working with school-related problems. As systemic clinicians, really a normal investigation into a problem that comes into your therapy room may lead a clinician to ask about school-related impairment as a normal process, gathering information. This really can trigger collaboration between the school staff and leadership with the private practice. In some states, private practitioners are allowed to visit schools, practice on campus, receive insurance reimbursements for those services outside of their office, which can really facilitate this, this collaboration. Arkansas, for example, is one of the states with our Medicaid program. So as a private practitioner right now, I do this and work as in the private practice that I'm a part of, we are working to establish a more clear model of what does it look like for a private family therapist, private practice family therapist to work in a school or with a school, just because we value that we have a lot of value on school in a student's mental health treatment. It's for many students, the primary place of intervention for their mental health. So in that, I'm hopeful to be back next year with a more crystallized version of what we do for school-based family counseling in a private practice. And likely a more common option for many people is kind of an arrangement or a community partnership between schools and community mental health agencies in providing those services in schools. With this arrangement, there can be a variety of experiences. Some clinicians may be embedded in schools within an office, almost be like school staff in and of themselves. Other clinicians may visit their school and even have multiple clients at multiple schools. These clinicians probably travel a lot, work out of their cars, you know, is kind of the picture that you can paint for yourself. Arrangements along these lines often have, you know, various considerations of how this happens with insurance panels, Medicaid, grants, contracts between schools. Some schools have a larger hand in controlling those contracts. Some, it's kind of a free-for-all. And some of us probably have experience in various of those settings. So kind of looking ahead for our schedule on Sunday, I'll be presenting some research about the experiences of MFTs working in schools. I think you'll find some interesting themes there that emerge from the research, including the experiences of really being embedded in a school and being considered staff versus being seen as more of an outsider to the school, even as a family therapist with that systemic perspective. So hopefully you'll tune in then. Additionally, community partnerships can include really the placement, for example, of graduate level trainees in schools through contracted agreements. For example, in Monroe, Louisiana, we have a program that was grant funded for placing MFT interns in a school doing prevention work, psychoeducation with students and families through grant that's funneled through the university in a private practice. Other notable community partnerships that you may be aware of include, for example, the Promise program out of Broward County in Florida by Dr. Ann Rambo, using Nova University students to operate really a solution-focused brief therapy-centered alternative to suspension program in the local school district. So with that in mind, Dr. Laura Wallace is going to help us understand a little bit better kind of the systemic and MFT interventions in schools.
Thank you, Wade, and thank you all. It is such an honor to be presenting here and to be in conversation with all of you. And I think that conversation is really the big theme in all of this. As you can see, all 5 of us have been working together for the last 2 years to really promote the cause of marriage and family therapists in schools. And one of our biggest audiences for that have been marriage and family therapists themselves. As we are all trained as marriage and family therapists and systemic thinkers, it's a little ironic to me how much that systemic thinking gets applied to the families. And then when we go to another system outside of the family, there's a little bit of a hesitation on the part of marriage and family therapists. At least that's been my experience. And as a former teacher myself, it didn't make a lot of sense to me. And so part of my interest in this whole endeavor has been to highlight some amazing research that's been done to apply the concepts of systems theory and family therapy itself to systems outside the family. And if you look at the research, there is just a plethora of options that have already been done, and then enormous areas for growth and improvement in applying family therapy theory to the schools. Anything from making sure that school counselors do their own self-of-therapist work. One example of this would be the use of a family autobiography or even our basic genogram in allowing school counselors or marriage and family therapists who are going into the schools to identify ways that our own family of origin impacts our work with students, impacts who we see, how we see them in the classroom setting. Other applications of that could be family of origin work done with teachers. And I'm a huge believer that systems work done with teachers, really any mental health work done with teachers, has an enormous impact on every single student that teacher comes in contact with and every single staff member and school personnel. So that's one example of an application that could be easy to overlook, but is so important. Another example is strategic therapy, which can seem a little odd to apply in a school-based setting, but something like a version of the invariant prescription has been applied in the literature with huge amounts of success. And finally, of course, solution-focused therapy, which has been incredibly well researched in schools, has an enormous number of interventions. The one that caught my attention as I was doing my dissertation research and working on getting my PhD in marriage and family therapy was the application of solution-focused therapy, not just to a school, but to a specific classroom setting. In some ways, this intervention saw the classroom itself as a family system where we can apply some of the same family counseling techniques to improve the hierarchy, to improve the relationships between classroom members, to consider the teacher as that figure of and that source of structure within the classroom, and then to look at each of the students as members of that broader system. And so as part of my dissertation, I worked, it was a grant-funded program. I also used interns at my graduate program to actually conduct the solution-focused work. We were amazingly honored to be trained by one of the creators of this model, Lee Schiltz, who came to San Antonio, Texas, and trained the interventionists who were going into the schools. And for those of you who are unfamiliar, but Working on What Works is a manualized 10-week classroom-based intervention. It was created by Insoo Kim Berg and Lee Schiltz in Florida. And the idea behind it is that schools and teachers focus so much and are taught to focus so much on the negative things that happen. And so if a coach, an external interventionist can come into the classroom and start identifying the things that are going well, that has the power and potential to just shape the entire perspective of both the classroom leader, the teacher, and then the students themselves. It has the power to shift the relationships and really change the sense of community within the school. So the study that I conducted evaluated Working on What Works in a randomized experimental post-test only design. We took 30 fourth and fifth grade classrooms in San Antonio, Texas, both public and private classrooms, with 30 teachers, and all in all, the study encapsulated data from 413 students. Interestingly, the most significant finding we had was that the students who participated in the WOW intervention had significantly fewer days absent from school compared with the control group, which was just an amazing outcome to have in demonstrating the impact of a systemic solution-focused intervention into the classroom. We also found that the teachers' ratings on their own classroom's performance improved significantly more than the teachers' ratings from the control classrooms. And this was interesting because as an outcome, it was something that we could look at and say, well, did the classroom really improve, or did the students' perception of the classroom improve? But either way, the intervention was effective, because how the teacher perceives their students is a huge part of creating classroom culture and is incredibly successful, and at least in our perspective as the researchers. It was a really exciting study to conduct and to be a part of, and we were lucky enough to get it published in the Journal of Marriage and Family Therapy in January. I worked along with Audrey Hang Hai and Cynthia Franklin at the University of Texas at Austin to finally publish this research and get it out there. So that's one example of how a solution-focused, systems-based approach to classrooms can have real concrete research-based effects. And we're really excited about the future of this research and really all research that is applying that family systems perspective to the school-based environment.
Very exciting. It's very exciting. And these are all kind of picking up on what we've talked about so far at the conference about sometimes we work with teachers, sometimes we work with students, and these folks that Laura and Wade and Aaron have talked about are folks that we've also highlighted at some of our Zoom interviews and in our spotlight. We're going to have Anne Rambo later on this year talk about her work in Florida. So thanks, Laura. Thanks, Wade. Good. Okay, and now Eileen is going to talk about the wonderful work they're doing building community partnerships in Humboldt County, California. Eileen?
Thank you, Kathy. I'd like to speak to you about community partnerships and highlight one in particular. As I reported at last year's Oxford Symposium, I have been involved with a grassroots project at a high school where I work as a marriage and family therapist. The high school is located in Humboldt County, a very rural section of Northern California. Arcata High School has a student population of 1,200. Some of our students have very healthy relationships, and some of our families have been struggling with destructive relationships for generations. Our goal was to develop a program to embrace all families. We wanted to create a safe place and build trust where everyone could be accepted and loved for who they are and not feel judged. We created a 6-week pilot project where we served dinner one night a week. We invited 14 of the most high-risk families and 6 participated. We had them join a small group of school staff and students from nearby Humboldt State University. Everyone shared a meal together prepared by the high school culinary class. We all ate at one large table together. It gave the school staff and community members an opportunity to model healthy relationships during the mealtime. The university students majoring in psychology, social work, and child development provided age-appropriate fun activities for the high school students. Childcare was also provided for the younger children after dinner. The parents were free to leave or stay after dinner for activities or conversation with the marriage and family therapist. Everyone came back together at the end of the evening and was encouraged to express what the experience was like for them. After 6 weeks, we could see the benefits of our program and see where we needed to make some adjustments. For example, to be flexible and remember, trust takes time, but it's worth establishing. The pilot project was successful, and we decided to continue it for a second year. More community members have started to participate, which is generating more positive relationships between school, home, and community. Due to the COVID-19 pandemic, we put our program on pause, and we are looking forward to starting it up again when it is safe. Studies done by the National Association of School Psychologists and the Coalition for Community Schools have demonstrated that when parents, communities, and schools are working together, students do better and everybody benefits. Thank you.
Thank you very much, TIN group. That was great. Do we have any questions? Open up the discussion.
Well, I just wanted to summarize real quickly that what we're trying to do is link systemic and family-friendly initiatives, build multidisciplinary teams in schools, and then to really grow our SBFC library in our Topical Interest Network so that more people, so we can spread the word. Does that summarize it, Aaron? Okay.
I have a comment. Thank you. Thank you very much for this team and for your active work promoting school-based family counseling within the family therapy profession. It seems to me increasingly important that we want school-based family counseling to be kind of like family therapy was in the 50s, to be sort of adopted by people excited about it in all the different professions. And so you folks within the family therapy profession are pioneering it. I think that's really great. And that hasn't always been the case. As I think one of you mentioned, if you go back and look at the literature, school counselors were kind of the first to sort of notice that families are important because they come to the school and make a bit of a nuisance. But family therapists are now getting much more involved. And I particularly wanted to point out that it was Kathy and also Ralph Cohen that worked together to get MFTs licensed and approved to go into schools in Connecticut, which was a major achievement. And Eileen, in the program that you did, getting parents to be involved by like having them for dinner. I mean, a simple thing like that creates powerful connection with parents, and that's a wonderful thing to do. And Laura, doing a randomized control study of any sort is an ordeal for the researchers. So I just want to commend you for having done that.
I wonder if I could ask a question. I'm very interested in the direction I think you're moving in, which of creating multidisciplinary teams in schools. And one of the things that I'm starting to think about, and I'm just curious if you have any thoughts on this, is how you think about supervision of trainees in an interdisciplinary team. I think, in marriage and family therapy, a lot of the supervision traditionally has been on self of the therapist and on sort of keeping a systemic frame. And I'm just curious, when you start working with classroom teachers or school counselors and other school system, have you given any thought about how that could be coordinated in terms of thinking about the work that we're doing with children and families? And I don't have an answer myself. I'm just really starting to see the power of this, and would like, from a school counselor educator point of view, hear what you're thinking. Maybe Kathleen, I don't know if you have thoughts as someone who's done this a while.
Well, it's really been a core of a lot of the work that we've done. That one of the first things is that when we have gone after initiatives like certification, like licensure, we have gotten those of us who are multidisciplinarily trained to advocate for partnerships. For instance, when we got the licensure law for family therapy passed in Connecticut, I testified as both a social worker and as a psychologist. And so making those connections, those relationships, we always use a slide in our national presentations about playing well in the sandbox, that if you're truly a systemic thinker, you've got to think of, especially in new areas, ways that you can achieve alliances. So I think that's one way. Another, and this was alluded to earlier in the presentation, have gatherings, have food at those gatherings, so you can have conversations. Most allied professionals can talk about some of the discomfort with being guests in education, guests in the system. As I was the first school social worker in Waterford, Connecticut, many years ago. And I used to say it was like a Rorschach. That each of the 8 schools I went to wanted something different from me. And so to be able to be flexible systemically about how to use your clinical skills, and then to be able to make those connections as best you can. I think recognizing that we are still the newest licensed mental health group, and it's going to take some time. So we have to think in 5-year, 10-year increments as well. But we got to play well in the sandbox while we're waiting.
Can I add to that? So being a school psychologist at a school district and being trained in the multidisciplinary functioning and in relationships, that I do often bring in MFT people to be part of the team in the IST team meetings where we have intervention strategy team, and they come in and have discussions about the children that they serve. And it's well needed. I mean, we have different roles, and the type of service, the counseling and all that, it is very, very needed in the integrated way. The only thing is about budgetary constraints in the district, where they have to limit, like it's limited to middle school right now, but you hope that it goes down to elementary school level, and that there is a team of MFT, psychs, counselors, administrators, everybody working together on behalf of the student. And now that we are more aware of the social emotional needs, and there's a direction that we're going there with the national awareness of mental health, and that the funding should be available from the federal to state to local schools to have more robust teams that serve all students. And that it's not happening yet because the money is spent where the priorities are, and sometimes mental health becomes the least of the priority when they have to cut corners and all that. So I think, the awareness and the push for support so that we could have more people to be part of the multidisciplinary team and to be able to collaborate and work in the areas of expertise, like in the family, in trauma, with relationships, all those things. It may take more time than what the school psych or the counselor can afford. And so there's a real need there, but I think there's a lot of limitations because of the budgetary constraints.
I think that is true. But I think that systems thinkers are always looking for the positive reframe. And I think one of the things we are experiencing, and we heard this from one of our call-in connections with one of our students who's a freshly minted MFT in New York City. And one of the things she said is that with the COVID crisis and with the what's going on culturally, racially in our country right now, the wave of that is happening about uncovering some of the systemic implications of racism, sexism, cultural discrimination in this country, that the redlining being a real blatant example, that there have really been planned ways of keeping people disenfranchised, and that as people who operate in schools, for those of us who have been privileged to be able to understand that what we're experiencing, what Aaron and I have no power up in New England because of this recent storm. What many people experience is that on a daily basis, that kids have not been able to get access to Wi-Fi through COVID, coming from more urban communities. So the systemic opportunity to join with other clinicians, with other systems that are working with kids, it's an opportunity, I think, for all of us. It's also an opportunity to integrate mental health with health that we have not seen in a long, long time. So it's I believe, a very exciting time for us to be doing this kind of systemic work in schools. Team members, what do you all think?
Well, I just wanted to go back to Karen's comment. Thank you for the comment about the systemic supervision of multidisciplinary teams. I actually find, so I've had the opportunity now to work in 3 different states and supervise in 3 different states, and 2 of those states allow marriage and family therapists to supervise several different professions, social workers and mental health counselors, to their license. And I really find that the systemic perspective and even the understanding of what we bring in ourselves to our work isn't even something that is a question for people who work in schools. I teach a class of educators in training, and when I talk about marriage and family therapy concepts, the system, the idea that we are our biggest tool, either in the classroom or the school, there's never any pushback. People who work in schools seem to understand that interconnectedness that we as marriage and family therapists seem to find so novel or experience as novel in maybe the counseling world. But those systemic concepts are really very accepted. And I find there's a need for that sort of supervision and a desire for that supervision among other professionals as well. As long as, like Kathy says, we can bring a humility and an understanding that what we're saying may be important, but it's not necessarily novel. It's a perspective that we offer, but we are one voice of many very valuable voices.
We are also working in AAMFT in the approved supervisor training. We are working to train supervisors in some of these new practice areas. There are several of us who've really lobbied for this, and we're having Zoom discussions because so many of those folks are my age and older, and the new areas where people are practicing are attracting a lot of our younger brothers and sisters in family therapy. So to be able to address this systemically in supervision, I think is so important.
Just to piggyback on those ideas, I also have found in my supervision work, it's been very important to help MFT students understand what every part of a school system does. I think it's actually something we tend to overlook in terms of what do each does each person play? What is their role? What is their function? And to really break it down and to talk specifically about what an educator does versus a school counselor versus a school psychologist versus the office staff. I think sometimes we bring a lot of assumptions to what people's roles should be based on some of our own personal experience or what we would hope or expect. And to actually break it down and talk through, well, this is what that person is or isn't trained to do, and this is what that person in this particular district takes on or maybe doesn't take on, or how can you collaborate with that person or build an alliance. One of my favorite stories that Kathy knows, you know, and I know also, is students who have made best friends with the school janitors. And that has been one of the best ways to make inroads into a school system. And so to think multidisciplinarily, not just about our mental health disciplines, but about every single part of a school system, I find that to be very, very helpful for my students in their training.
Thank you.
I was gonna say, I agree. And there's a little bit that I'll be able to speak to a little bit more on that on Sunday, of just the theme of the naturally systemic environment being, especially in elementary schools, with so many disciplines and supports being there naturally. And, you know, from secretary in the front office to janitor to everybody, being able to engage that is really, really helpful. And that most teachers, a lot of teachers are already, you know, mindful of a lot of these concepts, though they don't use the terms that we use. And so to go in with our terminology can be helpful, and sometimes helpful for us to kind of not use our terminology and just explain it in their terms so that we can cross that divide.
I find that schools, families, communities are hungry for what we have in school-based family counseling. I mean, it's just like people want things to really work out well. They just don't know how to do that. And it gives us an opportunity to help make that happen, if that makes sense. Yeah.
All righty. Thank you, TIM group. I'm going to go ahead and pass it on to Selena. Selena, can you take it from here?
Yes, can you hear me?
Yes.
Well, first of all, I would like to thank to all of you for the wonderful presentation you have done. Really, I'm very, very touching for me, because I have been listening to you how you have been working in these last years. I really want to congratulate all the team for the sustained effort to incorporate family therapies in a school, and for the creation of the teams that you have been doing in these last 2 years. It's amazing the result you have obtained in just 2 years, denote the dedication, the teamwork, and the passion you have been doing in your work. The encouraging results you have found in just 2 years underscore the importance of incorporating family therapies in the multidisciplinary school teams. Because family therapies, by their systematic training, enrich the school mental team in multiple ways, but in a very important way, by incorporating a systemic view and a culturally sensitive school-based approach. And I think this is very, very valuable, because this systemic approach to the school problem led us to understand them from a broader perspective, more sensitive, more open, more positive, and more sensitive to the needs of each group. So I really think that it's involved attending the multiple factors that shape the development of the children and the adolescents, and consequently broadens our scope to new years of intervention. It's open our focus to new areas of intervention. And I think this experience points the way to follow for mental health teams in school, indicating that to address the difficulties of the children and adolescents in school, to help them to achieve a successful school career, to promote their healthy development, and to help their families, we should create bonds between the family, the school, and the community. And so really, really thank you for this contribution, for let us know that we have to work together. And I would like to end and thank you to all of you for your excellent work, updating a phrase from you that say, many hands working together can help change a family. And I think this is sum up what the hard work you have been doing and the wonderful results you have obtained. So thank you to all of you.
Thank you very much. So you guys have about 5 minutes or so if you want to take some time, and then we'll hear from